Good morning, everyone. My name is Reverend Tania Smythe. I will be your moderator for today. Happy Wednesday. I hope all of you are safe and healthy at this time. It is a pleasure to be with you all again. Last time we were together was November 19th of 2019 for the launch of Cities Changing Diabetes Philadelphia. A lot has transpired over the past 14 months. Like the rest of the country and even the world, Philadelphia has been greatly affected by COVID-19 pandemic, with the most profound impacts occurring in our most vulnerable communities. Our city also joined others across the nation in civil rights protests and the unprecedented mobilization for social justice and anti-racism led by the Black Lives Matter movement. What hasn't changed in our communities are persistent challenges from poverty, lack of employment, and education opportunities, health inequity, and food insecurity. In fact, the pandemic has only exacerbated these challenges. But despite the many challenges and hardships over the past year, Philadelphia is resilient, and we are there for one another, proof that good things also happen in Philadelphia. A perfect example of this is how different sectors of the community that contribute to the health and well-being of our residents came together this past year to collaborate and partner on developing new solutions to address the city's obesity and diabetes epidemic. It's very impressive and beautiful of how these diverse organizations and agencies not only collaborated, but most importantly, how they incorporated the voice of the community in their important work. It is this promise of these interactions, sometimes challenging ones, albeit, that open up a better future for all of us in Philadelphia. These are the factors at the core of how Faith Community serves our beloved brothers and sisters in the community. And it is these factors that drive my involvement in Cities Changing Diabetes. Sometimes working with corporations, pharmaceutical companies, or other large institutions can give community-based organizations and faith-based communities trepidation and pause. Yet Novo Nordisk has demonstrated respect for our communities and willingness to listen and to serve as a catalyst for the beginnings of conversations that will yield new interventions and partnerships to improve health status of Philadelphians. So now it's with great honor for me to introduce to you the one and only Steve Albers, Corporate Vice President with Novo Nordisk.
Reverend Smythe, thank you so much for that incredible introduction. Good morning and welcome to all of you. I'm Steve Albers. I head up market access and public affairs here at Novo Nordisk in the US. And I certainly hope all of your families and loved ones and all of you are safe and healthy. It's been just over a year since we launched Cities Changing Diabetes in Philadelphia. And it's been a year that's tested us in new ways. It's brought lingering issues that we know need to be addressed to light. In a year of adjusting and pivoting and adapting to these challenges, it has underscored the critical need to address health inequities and change the trajectory of diabetes in Philly. Through Cities Changing Diabetes, our local health, faith, business, academic, and nonprofit communities have come together to create a new diabetes solution targeted to their neighborhood's unique needs and to help overcome health inequities and access issues. We know this work is critically important to all of you, and we certainly appreciate that you have persevered through the pandemic and racial and societal unrest when your day jobs required overtime attention and while also caring for your families. We know that people with diabetes and obesity are at increased risk of complications from COVID-19, and that these diseases plague many communities of color. As we start the new year, Cities continues to be an absolutely key program for Novo Nordisk globally and here in the US, and certainly very much right here in Philadelphia. And so to demonstrate that commitment and in recognition of the critical work that you're doing, we're pleased to say that Novo Nordisk will be providing $100,000 in preliminary funding to be split evenly among the 5 projects selected for the Cities Changing Diabetes portfolio in Philadelphia. And those are Activate, Advocates for Diabetes Prevention, led by the Health Promotion Council; Developing a peer and community approach for managing diabetes and disability, led by Temple College of Public Health. City of Hope, Latinos Preventing Diabetes, led by Esperanza and Jefferson. Eat to Live, led by Congreso Health Center. And finally, Prison Pre-Release Health Initiative, led by the Food Trust. So this morning, you're going to hear from some of today's most passionate advocates to learn about these innovative projects that will be developed to help the community leaders address the diabetes epidemic for the people and neighborhoods of this great city. 7 years ago, we embarked on this journey in the city of Houston. And today, there are more than 7 sustainable programs under the city's Changing Diabetes umbrella there. And we continue to have the honor of being a long-term partner for the city of Houston. But today we're incredibly excited to be a partner here in Philly. It's an honor to embark on this journey with all of you. And I am just incredibly excited about seeing the kinds of things that we're going to be able to accomplish here for our neighbors, but doing it together. So Novo Nordisk, and certainly myself, incredibly humbled to be a part of this extraordinary partnership working with all of you, and want to thank you all for being here again with us today. Reverend Smythe, with that, I'll hand it back over to you.
Thank you so much for that. This is really exciting. Thank you to the groups that took time out of their schedules to create these ideas and proposals to help the community. These are a lot of amazing group projects that have been selected as part of City's Changing Diabetes Philadelphia. So thank you. To talk more about the preparation and selection process, I would like to introduce Susan Cosgrove with the Healthcare Improvement Foundation, a primary partner for Cities Changing Diabetes in Philadelphia.
Thank you so much, Reverend Smythe, and thank you to Novo Nordisk. Thank you to Steve for supporting Philadelphia and becoming the first Cities Changing Diabetes city to launch a new virtual platform designed to foster communication, collaboration, and innovation. The Innovation Challenge provided local stakeholders with opportunities to explore new partnerships, gain input on innovative ideas, and build the foundation for the next big diabetes interventions in Philadelphia. So if all of you remember, we began last June with a call for ideas. We began with an open call for submissions for ideas to address diabetes and obesity, and our goal was to get 25 ideas. In less than 3 weeks, with the enthusiasm from many diverse organizations serving people with diabetes, we far exceeded that goal. We received 43 ideas for consideration by the Cities Changing Diabetes Philadelphia Advisory Board. And from this impressive pool of submissions, the advisory board selected 12 ideas to be developed into full proposals. To do this, the idea teams participated in a boot camp that included coaching and training webinars from local and national experts, hearing success stories from other Cities Changing Diabetes sites in Houston and worldwide, collaborative discussions, and technical support from the Cities Changing Diabetes project team. The proposal development process encouraged idea teams to consider how their Philadelphia. The boot camp culminated in each project team delivering a 5-minute pitch highlighting the key features and most compelling aspects of their program to a panel of advisory board members and community representatives. The pitches and written proposal summaries were evaluated by advisory board members and community representatives based on criteria that included the need, feasibility, innovation, collaboration, community engagement, impact, health equity, capacity to deliver, and sustainability. The ideas that advanced to the boot camp included submissions from Congreso, Esperanza, the Food Trust, Jefferson Health System, Health Promotion Council, Penn Asian Senior Services, Philadelphia College of Osteopathic Medicine, and departments within Temple University College of Public Health. We recognize the thoughtfulness, dedication, and passion that each team put into their idea, proposal, and pitch. Each proposed idea was impressive in its own right, and each pitch displayed the team's deep commitment to improving diabetes and obesity prevention care and management in Philadelphia. I know that I speak for the whole team when I say that you all did an incredible job during a very turbulent time with COVID-19, civil rights demonstrations, and other events in Philadelphia. And we're just so grateful and so proud of all the hard work that all of our bootcamp participants put into their ideas and their proposals. Thank you to every Philadelphia stakeholder, partner, community representative, organization, everybody that we worked with, everybody that took part in the Innovation Challenge by participating in a webinar, providing feedback, evaluating proposals, our advisory board. All of you really contributed to its great success and made it a model for future virtual collaboration. Today, I'm so excited to introduce our panel. We're going to hear from representatives from each of the 5 selected projects that Steve announced. And these projects will be the priority initiatives for Cities Changing Diabetes Philadelphia over the next 3 years, and hopefully beyond. These 5 projects represent different types of backbone organizations, serve community members in new and innovative ways, and promote collaboration to address health equity challenge faced by so many of the communities in our city. I will now introduce our panel. So Activate Advocates for Diabetes Prevention, submitted by by Health Promotion Council and Public Health Management Corporation, will train youth ages 13 to 18 to become community advocates for policy and environmental change solutions to prevent obesity, diabetes, and prediabetes through partnerships and new media platforms. Representing Activate is Allison Davis from Health Promotion Council. Champions of Hope, Latinos Preventing Diabetes is a collaboration of Esperanza and Jefferson Health System, Thomas Jefferson University Hospital Center for Urban Health, and Thomas Jefferson University College of Population Health and College of Nursing. It's an intergenerational Latinx diabetes prevention program that will engage youth leaders with community health workers to expand community health education in the Hunting Park neighborhood in North Philadelphia. Speaking on behalf of Champions of Hope is Nilsa Graciani from Esperanza. Developing a peer and community approach for managing diabetes and disability, submitted by Temple University, will design a peer-based approach to connect individuals from disability communities experiencing spinal cord injuries, intellectual and developmental disabilities, and serious mental illness to sustainable and accessible resources necessary to managing their diabetes and maintaining a healthy lifestyle. Speaking about this program today is Gretchen Sneathen from Temple University College of Public Health. Eat to Live, submitted by Congreso de Latinos Unidos and the American Heart Association and Health Promotion Council, is an expansion of the pilot program Eat to Live and will provide more underserved populations with personalized non-medical interventions, including peer support, monthly produce baskets, nutrition education, and cooking demonstrations to support healthier eating and address high rates of obesity, diabetes, and hypertension. Here to discuss this program is Judith Emons from Congreso. And then finally, the Prison Pre-Release Health Initiative, submitted by the Food Trust, is a nutrition, education, and cooking series to help address obesity, diabetes, and other chronic health conditions in a recently incarcerated population. This 6-week series is designed for inmates and returning citizens to help them make healthier food choices in prison and learn to shop and prepare healthy meals upon returning home. Representing the Food Trust today is Wayne Williams. Thank you all for being with us today, and we can't wait to hear more about your programs. So with that, we're going to move into our panel. And I'd like to pose the first question today to Nilsa. So Nilsa, Cities Changing Diabetes is really built on multi-stakeholder collaboration. Could you speak to how Esperanza and Jefferson's ideas evolved as you decided to work together and submit a single proposal? So the Champions of Hope really was kind of your proposal and Jefferson's proposal combined. How did that come together?
Thank you. We're so excited to be here. But the Champions of Hope, Latinos Preventing Diabetes, was actually born from a combination of 3 different projects. So Esperanza had originally partnered with the Society of Ibero-Latino American Medical Professionals, the National Association of Hispanic Nurses, and the Latino Medical Student Association, which are 3 professional organizations that include mentoring youth and educating the community as a big part of their mission. So together we understood the importance of having more Latinos involved in healthcare and as a means to decrease health disparities. And we also valued providing language and culturally relevant education materials in order to obtain better health outcomes. So Esperanza and Jefferson have a history of collaborating in other initiatives in the past. And when we heard the other groups' presentations at the beginning of the boot camp, we realized that we needed to talk. So when we explored joining our projects, we recognized that the synergy would create a much stronger proposal with greater impact to the Latino community in Hunting Park. So by joining together a world-renowned research academic institution, a nonprofit organization with deep community roots, and an array of services to build an opportunity community in Hunting Park, as well as the Latino professionals in the health field, our project has the needed elements to move quickly into implementation. Each of the groups is bringing to the table an area of expertise and/or access to the community, so that together we have a national diabetes prevention program, a community health worker certificate program, health screening capabilities, youth mentoring, Latino health professionals, and access to students in K through 14 system, and also community members at large. So we also have the ability to communicate with the community via text campaign, email, or even with a weekly door-to-door newspaper. So all of these elements put together will allow us to create an intergenerational diabetes program where youth is the catalyst for community health education.
That's great. Thanks, Nilsa. That's such a great example of exactly the type of collaboration that Cities Changing Diabetes is hoping to foster long-term. And I think we'll also hear more from Allison later about, the importance of engaging youth in these initiatives as well. So my next question is for you, Wayne. So many of the selected projects focus on promoting equity for vulnerable populations, and the Food Trust Prison Pre-Release Health Initiative is certainly one of them. Can you tell us a little bit about how you're incorporating the voice of the returning citizen into your program?
Thank you, Susan. That's a good question. One of the ways in which that we thought that we could include the voice of this particular demographic is get them engaged in the very beginning, to have conversations with them to see how they see nutrition, how they see chronic disease, and how we could develop a program that would fit their needs and help them to understand the importance of the program. So part of it is in the very beginning, as opposed to talking directly to them about nutrition, we like to know about them, where they came from, where they will be going. Are they married? Do they have children? This is important information because it allows us to connect with them on a level in which that we can develop a specific program targeted at them. And then we have also partners in the Philadelphia Reentry Coalition, a program in which where we can begin to train some of these participants so that they will come into the diabetes, chronic disease, and actually get paid for this form of training so that they will become not only just participants in the program, but the goal is that at some point in time that they will become facilitators as we begin to grow this program.
That's great, Wayne. I think a really great demonstration of how, designing a program alongside the people that it's for is just so critical for the success of a program, and really excited to kind of see where you guys go with it. So my next question is for you, Gretchen. So your program also works with another often overlooked and vulnerable population that has higher rates of obesity and diabetes. So how will developing a peer and community approach for managing diabetes and disability engage with the community to identify and meet the unique needs of people with disabilities and the community-based organizations that serve them?
Good morning, Susan. Thank you. Really, we wanted to look at disability and diabetes, partly because Philadelphia has one of the highest percentages of individuals with disabilities of 10 major cities in the United States. And individuals with disabilities, including those with serious mental illnesses, spinal cord injury, and intellectual and developmental disabilities, are 2 to 3 times more likely to experience diabetes than the general population. These individuals often experience their communities as physically and socially inaccessible, which leads to isolation, sedentary behavior, and poor dietary habits. Our project starts and ends in the community. Its development starts with community input. Our team has an established record of working with community organizations that really promote health and support individuals with disabilities to live in their communities. Most important is our efforts to engage people with disabilities to inform the development and implementation of the program. Input from these stakeholder groups will focus on strategies that will address the health inequities experienced by those with disabilities, really looking to improve the conditions of daily life, reducing the inequitable distribution of resources, and supporting the development of knowledge of the physical, social, and behavioral environments that contribute to sedentary behavior. The final intervention program will be embedded in the community and will utilize resources such as parks, libraries, and recreation centers to really improve health behaviors. The program has the potential to create meaningful impacts that benefit both those living with disabilities and their communities. First, we're proposing to provide opportunities for job training that would employ individuals with disabilities in mainstream community settings, addressing the problem of both segregated work environments and underemployment. Second, the peer facilitated programs are linked to empowerment and sustainable outcomes. We will target the underlying activities that contribute to the key determinants of sedentary behavior and poor dietary habits, including social isolation, loneliness, and engagement in interest-based community activities. This approach supports the development of the skills necessary to live healthy lives in the community. And finally, by supporting individuals with disabilities to participate in communities alongside those without disabilities, this program has the potential to create more welcoming and inclusive environments, which is really better for everyone.
Thanks so much, Gretchen. I think lots of noteworthy components of your program, but I think in particular, as we see kind of the economic impacts of COVID-19 continue, the fact that you have kind of a job training component of this, I think is really, really critical at this time. So I'd like to move next to Judith and hear a little bit more about Congresso's Eat to Live program. So this is a program that has already been successful. I know you had a very, very successful pilot to address healthy eating and healthy weight to prevent and better manage chronic disease such as diabetes and obesity. So what motivated you to bring this program expansion idea to Cities Changing Diabetes, especially in the context of a challenging external environment with the ongoing COVID-19 pandemic?
Yeah, thank you for having us, and we're so excited to be here. So the original Eat to Live program came to us from an idea from one of our primary care providers at Congresso's FQHC, who suggested that we add non-pharmaceutical interventions like food access to our clinical care to support our uncontrolled diabetic and hypertensive patients in the management of their chronic conditions. Food insecurity, health literacy, other social determinants of health are real challenges in our medically underserved communities, especially those served by federally qualified health centers. And we know that our patients are more vulnerable to preventable chronic conditions and are disproportionately affected by poor health outcomes. For the pilot program of Eat to Live, we selected uncontrolled co-occurring diabetics and hypertensive from our FQHC to participate. And we paired their medical care with access to monthly produce boxes, nutrition education, cooking demonstrations, and other incentives. Additionally, each participant was given the opportunity to discuss their personal barriers to controlling their chronic condition with a licensed clinical social worker, such as barriers to exercise or cooking at home, and each of them developed a plan to address and overcome those barriers even after their participation in Eat to Live had ended. The pilot program was highly successful, with 73% of participants seeing a decrease in their blood pressure and 45% of participants losing weight and reducing their BMI. And furthermore, the program was just really well received by attendees and created a sense of community within our patient panel, allowing for participants to share their experiences with each other and create a support system as well as a network of peers. Seeing the success of the original Eat to Live program demonstrated the impact that an expanded program might have in other FQHCs, which also operate in medically underserved communities and have similar patient panels. Additionally, because all FQHCs have similar staffing structures, which includes the integration of physical and mental health care, Eat to Live is uniquely positioned to be replicated across the city. By expanding the program to additional FQHCs across the city of Philadelphia, there's more opportunity to have a greater impact on diabetes management across the city and with different populations in different areas of the city. Through Cities Changing Diabetes, the program we hope to expand to 10 federally qualified health centers, and will also be able to impact 1,000 participants in the first year of implementation. We'll be working with partners who supported the original project, including Public Health Management Corporation, Health Promotion Council, the American Heart Association, and Sanctuary Farm, who bring to the table expertise and collaboration needed to make this expansion project a success. The coronavirus pandemic has only added to the negative health outcomes faced by our communities, and we've developed a plan to deliver the expanded Eat to Live program in a safe and virtual manner. And we're looking forward to working with the FQHCs that will participate in this initiative to improve diabetes across the city of Philadelphia.
Thanks so much, Judith. And I remember, a little over a year ago when Cities Changing Diabetes was just taking off, Congresso hosted one of our roundtables back in the fall of 2019. And I remember having a conversation with you after that roundtable just about this specific program, that you had successfully piloted and had since come to an end. And I'm just so excited that we get to carry it forward with you and kind of work on expansion. So thank you very much.
Thank you.
Next, we're going to hear from Allison. And Allison, Activate Advocates for Diabetes Prevention. This is also based on a successful existing initiative. So tell us a little bit more about what is innovative about your new approach to addressing diabetes in youth, and what strengths young people bring to the fight against diabetes and obesity in Philadelphia.
Sure. Thank you. Good morning. So Health Promotion Council will call on our Advocacy Institute Youth Empowerment Curriculum, which focuses on building youth and adult partnerships in public health advancement. Over 250 Philadelphia youth to date have participated in the Advocacy Institute programming in areas such as tobacco use prevention, opioid misuse prevention, homelessness, and urban city planning. And youth who have successfully completed the curriculum report having new advocacy skills, as well as a greater understanding of how health justice impacts their communities. The Advocacy Institute curriculum not only advances important public health agendas, but it prepares youth to organize their communities, to interact with policymakers, as well as utilizing new media to reach broader audiences. We also utilize a peer-to-peer education initiative, which provides a more authentic and effective approach in reaching young people. So we're really excited to partner with the Health Promotion Council, Nutrition and Active Living team to bring about behavioral changes, as well as help youth address the systems that are in place that might make that challenging for them.
Great. Thanks, Allison. And I want to move on to just one final question that I'm going to ask each of our panelists to respond to. As we often do in January, I think we want to think about the year ahead and think about what makes us hopeful and what gets us excited. And so I'd like to ask each of our panelists to describe their hopes or what they're excited about as they think about what's possible for their programs and for Cities Changing Diabetes in 2021. And Allison, we'll start with you.
Sure. So Health Promotion Council, specifically the Advocacy Institute, has been primarily focused on youth tobacco and substance use prevention. So we're really thrilled to partner with Health Promotion Council's Active and Nutrition and Active Living team to expand into chronic disease prevention and management. Health Promotion Council is really excited to be the intersection of public health and community advocacy in the fight against adolescent type 2 and prediabetes.
Great. Thanks, Allison. Judith, what are you looking forward to?
Yeah. And so the ability to expand Eat to Live will allow us to extend this needed program to communities outside of Congresso and North Philadelphia. So we're looking forward to developing strong partnerships with the participating FQHCs, which will allow for synergy and idea sharing in a way that we really haven't seen before across FQHC networks. And, if anything, this past year has shown us that we're truly interconnected as communities, and this program gives us the opportunity to really address health disparities together as a team and improve the social determinants of health on a citywide level collectively.
Great. Thanks, Judith. Gretchen, what are you looking forward to this year?
We are excited that in 2021, Cities Changing Diabetes provides us and our fellow project teams with the opportunity to partner with mainstream community in order to develop programs for too often ignored groups of individuals, which will be embedded where they live, work, and play.
Great. Wayne, moving on to you. What are you looking forward to?
Well, at the Food Trust, me and my partner, Sandy, what we're looking forward to get back into the field and engage our participants. That's very important to us. It's been some time, of course, because of COVID, but because of the participation that we get from them, I'm looking forward to engaging them again and helping them to improve not just diabetes, but improve the quality of their thinking, the quality of life. That's what I'm looking forward to. Thank you.
I think that a lot of us relate to that feeling of looking forward to kind of getting back out there and being able to see people and interact with people again. Nilsa, what are you excited about?
What excites me is actually to see these 5 proposals that evolved and grew stronger through the process of the bootcamp continue to develop and actually become a reality. And of course, in particular, I want to see the Champions of Hope be a spark where young people make a difference in their families and in the community through education and prevention, decreasing the burden of diabetes and making Philadelphia a healthier place.
That's great. Thanks, Nilsa. So thank you again to all of our panelists, to all who supported or participated in the boot camp. You know, we extend our congratulations to our IDEA teams. And I know what I am really looking forward to and excited about in 2021 is the opportunity to work closely with all of you and advance all of these great ideas, and also continue to engage everybody who participated in the boot camp, and just see where Cities Changing Diabetes will bring us this year. For more information about these programs, to look at the proposals, or even to look at the initial ideas that prompted them, you can go to citieschangingdiabetes.nas.co and create an account to log in and view that. Reverend Smythe, I'll hand it back to you.
Mute myself, that would help. Thank you, Susan, and thank you to all of the panelists. That's a lot of work that you did, and you really thought about proactive things that you can do about demographics that are often overlooked and how you can put the community first. So I'm going to give you a round of applause for all the people that are participating and for all your work that you did. So thank you for that. Hearing firsthand about the approaches that you took in developing your ideas and the unique challenges in the community that you'll reach and have to face combating diabetes and obesity, and the potential impact that you'll have on their lives and the broader health of our city is very inspiring. So once again, thank you, not just for being here, but for what you do on a daily basis. So in continuing on, we have with us today the Representative Jordan Harris, representing the 186th district in our state capital in Harrisburg. The House Democratic Minority Whip has experienced COVID-19 firsthand, and he understands the importance of reducing the diabetes burden to make fewer people at risk for COVID-19 complications. So we are extremely pleased to have the Honorable Jordan Harris join us via video.
Hi, I'm Pennsylvania State Representative Jordan Harris, the Democratic Whip of the Pennsylvania House of Representatives. And over the past years, I've kept in touch with Cities Changing Diabetes program team, and I can tell you that I'm very impressed with how the program has developed. The project team was receptive to involving community leaders from my district and the process of developing new solutions for diabetes and obesity programs and prevention in Philadelphia. We are a very rich city of health and healthcare access, rich in world-class healthcare systems, world-class academic institutions, as well as smart people in government, corporation associations, and agencies. But unfortunately, our health outcomes and health disparities across the city don't reflect this. It is time that we draw on our common knowledge and expertise to come up with solutions that benefit our communities, neighbors, who may not have access to the preventative services or specialty care, neighbors living with the stigma of obesity and diabetes, and our neighbors going through a very difficult time dealing with COVID-19. I have seen this kind of collaboration and partnership happen through the Cities Changing Diabetes. Leaders from Philadelphia selected 5 strong proposals to fund for implementation. Many of these proposals came about through new relationships with large healthcare systems and academic organizations. As I mentioned before, their eagerness to work with community-based organizations and individual community members in new and meaningful ways. That gives me hope. That gives me excitement. And I look forward to watching the implementation of the 5 initiatives and staying up to date on what they can do for our city. Congratulations to the winners and best of luck.
Thank you, Representative Harris. We appreciate all you do for Philadelphia and your support for Cities Changing Diabetes. I'm Karen Gillespie, the U.S. Project Lead for Cities Changing Diabetes at Novo Nordisk, and I'm so excited by what we shared with you today, the strong and innovative initiatives that will be part of Cities Changing Diabetes in Philadelphia, and the remarkable energy and passion that catalyzed all this work. You heard it from the 5 team leads on the panel, and it's what I've had the opportunity to see every day working with Cities Changing Diabetes participants in Philadelphia. From the time that the program launched a year ago through the Innovation Challenge to today. It's been such a privilege getting to know all of you and to work with so many wonderful members and organizations. And I've watched you grow great ideas into really strong and impressive project proposals. And while many of you had worked together previously, you found new ways to collaborate and partner under Cities Changing Diabetes. And that's exactly what we had hoped for when we launched the program in Philadelphia a year ago. So the lasting legacy of this work be the outcomes that change communities across the city. Novo Nordisk will continue to support your collaboration. We will continue to stay in close touch with the teams. Our support will include technical assistance and assistance in identifying resources to further develop and sustain your work. Community engagement will be critically important to these efforts. So over the next 6 weeks, we will convene small virtual meetings for interested community members and organizations to learn more about the initiatives and to discuss specific ways that you can get involved. If you work or live in Philly and you want to get involved, please reach out to me or to Klaus Madsen, who's the stakeholder engagement lead. And you can learn more about the 5 ideas, as Susan had mentioned previously, at citieschangingdiabetes.nos.co, which is the virtual platform that we use for collaboration. And you can learn more about Cities Changing Diabetes, the global program, at citieschangingdiabetes.org. So with that, I just want to say a big thank you to everyone. And so excited to work with all of you in 2021 and turn it back to Reverend Smythe for a few final words.
Thank you, Karen. And I want to thank all of you that are participating this morning for joining us. You could be doing a lot this morning, but you chose to take time out of your day to be here and to hear all these great proposals and how you could probably help or collaborate with. I feel so fortunate to be with you here today and to hear all these proposals and to be a part of the advisory board that selected these 5 projects. And I know my sentiments are shared by many advisory board members, so let's watch.
I just want to say I'm really excited to hear about the announcement of these 5 great projects. It's been a wonderful time working with the advisory board and the Cities Changing Diabetes Group. They did an amazing job in a difficult period of time in our country. And I really, really look forward to hearing about these projects as they will be exciting for the advancement of care of individuals living with diabetes and obesity. Thank you.
I am so excited for what Cities Changing Diabetes is about to do in Philadelphia. I was so impressed with all the collection of proposals, and now I can't wait for the best 5 selected programs to do what they're going to do in our city. They will not only come together with community stakeholders and community advocates, community healthcare workers, and healthcare professionals, but how they will come together with each other to provide the utmost and the best outcomes for our communities in Philadelphia.
COVID-19 has increased awareness of health inequity among people living with diabetes. Through the Cities Changing Diabetes Innovation Bootcamp Challenge, we were able to begin a meaningful conversation on this topic. I see this reflected in each of the 5 winning proposals. We will continue this conversation as we further plan to implement each proposal. We have a lot of work to do. Let's get it done. I'm looking forward to working with everybody. Thanks.
A big congratulations to each of the teams from me. I can't wait to work closely with you as we seek additional partners in the community, including houses of faith. To all those that have joined with us today, you have the rest of the day to make a difference. So I really hope that this virtual gathering leaves you energized and motivated to take on the challenges of diabetes and obesity epidemic here in Philadelphia. Please enjoy the rest of your day. Thank you for being here. Thank you for all that you do. I pray that the rest of your day is a peaceful and joyful one and a safe one. Please be safe. Until next time, Philadelphia. Bye-bye.